Janaya, and I'll be your nurse today. Can I have your first name, last name, and date of birth?
Desmond Stevens, 10/19/2004.
Okay, Miss Stevens, the doctor has ordered for me to do a slight assessment on you, so I'm going to do that. But first, I'm going to start by asking you a couple questions. Have you had any headaches or any concussions?
No.
Okay, so I'm going to start by inspecting her head to make sure that it's symmetrical. Okay, her head is more so sympathetic. And now I'm going to look at her ears to inspect if there are symmetry, like in symmetry. Like they're kind of aligned with each other. Okay. Do you have any pain in your ears?
No.
Any drainage?
No.
Okay, do you wear hearing aids?
No.
Okay. Have you had any loss of hearing?
No.
No. Okay. So now I will look at her pupils to make sure they are round and reactive to light. So look at the light for me. Okay, her right pupil is reactive, round and reactive. And also her left, and they look both about a 2 in size. Do you wear any contacts or glasses?
No.
Okay. Now I'm going to inspect her nose. Have you had any loss of smell?
No.
Okay, so I'm gonna hold down her right side. Can you breathe in and breathe out? Any difficulty?
No.
Okay. I'm gonna hold down this one. Breathe in, breathe out. Any difficulty?
No.
No. Okay. So now I'm gonna observe her mouth and her. Ooh, you can't see me. I'm gonna observe her mouth and her neck. So first I'm gonna look in her mouth to make sure it's moist and pink and all of her teeth are there. Also, if her trachea is midline or not, and if she have any swollen lymph nodes. So, can you open? Look at your trachea, it's midline. Okay, let me see if you got any swollen lymph nodes. No? Okay, alright. Can you move your head forward? Can you move it backwards? Any pain?
No.
Okay. Any stiffness?
No.
Okay. Do you have a sore throat?
No.
Do you have any problem swallowing?
No.
Okay. Can you tell me your birthday?
October 19/2004.
Do you know where you are?
Macon, Georgia.
Can you tell me who's the president?
Joe Biden.
Okay. So she will be alert and oriented ×4 because she is oriented to time, place, situation. She could tell me her names of this person. That's good. And I'm gonna now explain the Glasgow code scale. Anything between 13 and 15 indicates no brain injury. I'm sorry. Anything under 8 is severe brain injury. Okay. So, do you have any dizziness or any problem with your memory?
No.
No. Okay, good. So now I'm gonna take a listen. Do you have at her lungs? Do you have any shortness of breath?
No.
Okay. This is her right upper lobe. Breathe in. Breathe out. This is her left upper. Breathe in. Breathe out. Okay. Breathe in. Breathe out. Okay, now I'm going to listen to her back. This is her right upper. Breathe in. Breathe out. Her left upper. Breathe in. Breathe out. Her right lower. Breathe in. Breathe out. And her left lower. Breathe in. Okay, breathe out. All right. So this is an extended spirometer. You will breathe in this 10 times per hour to reduce your risk of pneumonia after surgery. Also, I'm going to educate you on alternative breathing. You will inhale deeply, hold your breath, and exhale, okay? All right. Do you have a cough?
No.
Any mucus?
No.
Okay, good. And you said no shortness of breath or a cough, right? Okay. So now I'm going to inspect her for any JVD. JVD indicates any heart failure. So I'm going to turn your head this way and over. And there will be a vein popping out, a blue vein, but there's no vein popping out. So that's good. Let me check the other side. Okay, everything's good. All right. No JVD, no that, no JVD. Now I'm going to look at her pulses, and I will grade them in my charting. So now I will look at her radial pulse. Okay, now I'll look at her post tibial. I'll look in both. Let me look at the post, feel the post for the post in both arms. Okay, let me see. Post tibial. Okay, let me check over there. Now I will be looking at her dorsal pedis post and her foot, both feet. Okay. Now let me assess your capillary refill in your fingers. Okay. And the capillary refill, the blood should return back into the finger within 3 seconds. Okay. And then now I will palpate her for any edemas in her lower and upper extremities. Let me see your hands. Okay, no edema in any upper or lower extremities. So now I'm gonna listen to her heart. Are you having any chest pain?
No.
No? Okay, good. And this will be touching the skin, but it's okay. Because she don't have on a gown. So I'm listening to the aortic valve, the pulmonic valve, the Erb's point, okay, the tricuspid valve, and the mitral. Can you lift up your wrist for me? Okay, everything sounds good. So now I'm gonna start my gastrointestinal. First I will inspect before I listen. So I'm gonna lift up your shirt and I'm gonna inspect to make sure your stomach is round or anything. I don't see anything. So I'm gonna take a listen. You will listen to each quadrant for 1 minute, but if you don't hear anything, you should listen for 5 minutes. So I'm gonna start in her right lower. Okay. This is her left upper. Right upper, I'm sorry. Okay. This is her left upper. And this is her left lower. Okay, and like I said, you listen to all for 1 minute in the real order. Okay. Now I'm going to palpate to see if she has any pain or tenderness. Any pain or tenderness? Okay, and it's not firm or anything, so that's good. When was your last bowel movement?
Yesterday.
Yesterday? Okay. Have you had any nausea, vomiting, or cramping?
No.
No. So now I'm gonna do the last one. I'm gonna have with my musculoskeletal assessment. So I'm gonna get you to, I'm gonna use your wrist. Can I get you to go up and down? Okay. I'm gonna use the elbow. Can I get you to flex it and abduct it? Okay. can I get you to flex your wrist and abduct it? And now your elbow, flex it and abduct it. Okay, I'm gonna get you to do the same with your leg, with your knee. Can I get you to flex it? Okay, can I get you to abduct it? Same with your ankle. Can I get you to flex it? Bend it down, and then bend it up, bend it back. Okay. So now I'm gonna assess your gait. Can I get you to stand up and walk for me on your tippy toes? Okay. Can I get you to walk in a straight line for me? Can you back up and walk in a straight line? And can you walk just how you normally walk? All right. Do you have any joint pain?
No.
Okay. And that is the end of my assessment.